Hello and welcome back to the Little Green Farmstead. Today I have Rory. She is a 2-year-old hen. No, she's 3-year-old hen. And she has Bumblefoot for the second time in her life. Last year she had Bumblefoot. I cleaned it out and she's been fine until now. It is in the same foot that it was in last year. So it is common for a chicken with Bumblefoot to get it over and over. Usually it will happen a lot sooner, but I think I did a pretty good job of cleaning out her wound last year. So I do want to go over everything that I use and kind of how I'll try to capture what I'm doing. But I'm one person with a very unhandy tripod that's not completely adjustable. So I will do my best. But first I want to go over supplies because I have quite a lot of supplies that I use when I'm doing this. So first things first, you need a bowl of hot water. This is hotter than it needs to be because I'm outside. It's going to cool off pretty quick. This is chlorhexidine. You can get it at Walgreens. And it's very good for wound care and skin cleansing. I do have just a syringe with no needle on it, and that's going to help us irrigate the wound later on. For her enjoyment afterwards, I do have pediatric electrolyte solution. You can get this, they do sell one brand at Dollar Tree, or you can get it elsewhere. I usually buy the Dollar Tree stuff because it's pretty inexpensive. Do dilute this though, because too much sugar in a chicken it's gonna cause diarrhea, and we don't want that when they are trying to heal up from a wound. So but that's gonna give her a boost, and then I'll probably only give her a little bit, and then I'll give the rest to the other birds because they're my garbage disposals. Some PPE. I have a whole stack of gloves. I do have a wound on my thumb that I especially want to protect. Bumblefoot is very contagious. It is an infection. It is a staph infection, so you don't want to expose yourself to it. So I am wearing a mask as well. I have my protective eyewear on. I wear glasses, so I'm wearing my my safety glasses, basically. I need more places to put stuff. Just a second. Okay. Got a little box so I can put things on top of this box. Okay, so PPE aside. All right, so whoopsies. I want to show you the dressings that I use. And oh yeah, this is another snack for her for later. It's just a chicken treat. It's actually for baby chicks, but she's gonna need a good bribe for this because this is not going to be pleasant for her. All right. So I buy these dressings from my local farm store. You can buy this from Dollar Tree, but you're only getting 3 yards. There is considerably more in this package than that package for less money. I think these are 98 cents and these are $1.25. So I do have these, but I bought them a long time ago before I kind of found like these are better. And then all I do with these is I just cut them. So I get strips because then they're perfect width for wrapping chicken toes. And before I get started, I will unravel this. So that it's ready and I'm not wrestling with it while I'm trying to hold a chicken in my lap. So one thing about chicken wound care is being completely prepared and being over prepared, which is why I have so much stuff here because I don't know what I'm going to get into. So a lot of the stuff that I have here is just in case. So anyway, I will do that in a second. Okay, so those are the dressings. In addition to those, I have a couple. These are sterile gauze pads, and they are 2 different sizes because I like the 2x2s, but I couldn't find another one, and you should always have a backup just in case you drop it or the chicken like kicks it off and it falls on the ground. Always have a backup. So my backup is a 3x4, which I'll probably cut in half. I do have hand sanitizer for my hands. Again, I can't stress this enough. This is very contagious stuff. Please be cautious when you are treating any infection with any animal, but especially any kind of staph infection. All right, I do like this paper tape. This is that gentle, I think they also call it gentle tape. It's really got a lot of stuff on it, but this just goes around the sterile gauze and holds the gauze in place. And then we wrap the vet wrap, the stuff over top. And you'll see that hopefully later. And I have a hair, what is this? A shower cap for my hair because I don't want gunk in my hair. So I'm gonna go ahead and put that on right now. I'll look fabulous. You don't know, but I look fabulous. My favorite saline wound wash. We're gonna use this. And then we are gonna use the chlorhexidine solution with a syringe. And those are gonna be the 2 methods we use to irrigate this wound. I'm gonna put that down there. I do have iodine as well in this bag. I just keep it in a bag, but yeah, it's just the first aid iodine. So that will be dabbed around the wound around it, not in it. That's important. The iodine only goes around the wound to keep the skin around it clean, and so it doesn't gather bacteria. This is what I'll use to apply the iodine. They're just cotton rounds. Do not use these for wound dressing. These are not made for wound dressing. These will leave cotton in the wound if you do. It'll stick to the wound. They're not sterile, so these are just for applying things or cleaning up stuff. I use these just to clean up my tools or to clean up the area around the wound, and that's it. So just be aware of the difference between these and these. All right. So we've got some other things. So just in case she starts to bleed, I have the styptic powder. I do have petroleum jelly, and I have the triple antibiotic ointment. Remember, only use the kind that does not have pain reliever in it. It can only be the antibiotic ointment. It cannot say with pain relief. And if you look at the ingredients, it cannot have a pain reliever in it. It should only have the 3 antibiotic ingredients in it. Okay. Let's see here. And lastly, I have this pair of pliers because sometimes it's really hard to grab the kernel. It's what we call the infection that's in the foot. Infections in I don't know if it's in all birds or just poultry, but they tend to be really hard. So you do have to grab them and pull them out. So we're gonna use those for that. And before I even take her out of the cage, I'm going to stage my entire area. I will remove caps from things. I will, I've already unscrewed the hand sanitizer. I've already cut, but I will unravel my bandage. So I'm gonna start doing that now. I do like to put this like in a pocket if I'm wearing pockets, or in my bra if I don't have a pocket. Sometimes I don't have pockets, but it's always good to warm up whatever you're using on the actual wound itself. Warm it up because it's going to make it a lot easier for you to apply it to the wound. Otherwise it's going to stick to whatever you're trying to apply it to instead of the wound itself. So I'm just going to put this in my pocket and So I do have this suture kit that I bought. And I am going to use, I used to use an X-Acto knife to open up and kind of remove the infection, but I don't think that's going to be a great plan. So I am going to use some of the tools in this kit. I have like a nice pair of tweezers that have a tooth on them. Can you see that? Yeah. If I can take there. So it's got a tooth on it, so it should be able to grab on to the infection. And I have a long pair of these nice scissors. I did buy these from the pharmacy several years ago, and these are really nice. I did spring for the more expensive stainless steel ones because I wanted them to last. They also keep their point a lot longer. They keep their edge a lot longer than the cheaper ones. So what else is in here? We're not going to be using any of the any sutures. I bought this kit because I have had bird attacks and I kind of wanted to see if I could practice suturing. But there are scalpel blades in this kit, and I'm going to get one out just in case I need it. It depends on, I haven't really looked at her foot, honestly. I just see that it's really bad. So that is the suture. That's a suturing kit that I purchased. Oh, I forgot. Puppy pads. I like puppy pads to cover my work surface. Usually when I'm treating a chicken for Bumblefoot, my work surface is my lap. So I will put a puppy pad in my lap. Sometimes I will wrap the chicken in another puppy pad, so I just have a little stack of them right here for me to use. All right, now I'm going to go ahead and get everything arranged. So, okay. I'm going to put a glove down to put things on top of, I think, because otherwise I'm putting things on my dirty little bench here, which I don't. That's not a good idea. I'm going to get a stack of these are just the cotton rounds. Remember, those are the unsterile ones. And you are listening to the musings of my turkeys. I don't know if you can hear them. They have moved on since I sat down because they're bored with me now. All right. This has been rather vexing. Let's see here. So the reason I'm undoing this now is because, is because when you're wrapping a wound, especially a wound on a bird, you cannot apply any kind of pressure to the wound with the dressing, or you're going to cut off circulation. And to achieve the best healing we can, we need to make sure we're not cutting off any blood flow to the area. Because she can't heal if she's going to lose a toe. Oh, that's not fun. Not fun. Well, we might use you anyway. Had a good run. I had a good run. And I'm just thinking, I have a package coming today. My UPS guy, he sees all kinds of stuff. He doesn't even mention it. He's a good guy. All right. I always unravel a lot more than I think I'm going to need because, again, what if you drop it? What if it gets wadded up and you can't use it? Just being over-prepared is the best the best idea. And it seems like a lot of stuff for one little boo-boo, one little foot boo-boo. But all right, we're gonna call that good. That should be good. All right. I'm going to get I'm going to tear open the sterile pad just so that I can grab it out, but it's not going to be touching anything but my gloves. I'm not going to open this one unless I need to, and then I'll deal with having to wrestle that when the time comes. My dog is barking and I don't know which one it is. So I'm going to be right back. False alarm. Wasn't my dog. It was the neighbor's. Which is why it sounded so weird. Anywho. Okay, I'm back. Where was we? Oh, that doesn't need to go in my lap yet. Alright, I'm going to put my mask on. So, when I sound muffled, you know why. And I know people have all kinds of opinions on protective equipment, but I would rather not get this stuff in my mouth or my nose or my eyes. So you do you, but better to be safe than sorry. Okay. Honestly, if I had a paper mask, not an N95, I'd use that, but I don't. All I have are N95s. Okay, and KN95s. Alright. Oh, I did forget to mention I have like a few rags. I have a flour sack dish towel. That's usually what I wrap the chicken in so that they feel kind of secure. So when I get her out of the cage, that's what I'm going to wrap her in. And then I have just a couple rags here for whatever. All right. I'm going to put the chlorhexidine solution into my water. All right. And then I'm going to set that aside. You do want to dilute that quite a bit. So just like one squirt. I think I did a couple like half pumps or quarter pumps or whatever. It's not much. It's very, very diluted. So, and I'm doing this outside so that when I irrigate, everything just goes onto the floor, which is awesome. And then to stir it, I usually just take a few syringes fulls and do that, or you could just use a syringe. But I'm going to take a syringe and fill it and then set it, because if it's not full, it's going to fall into your bowl. Ask me how I know. Okay, I shall retrieve the bird. Okay, got my little towel. Going for the bird. Alright, you want to come out? You go fix your foot. I know. Yep. I know. Don't I know it? I think I'm glad I don't speak chicken. Right? Okay. Calm those kisses. Calm those kisses. Alright. Oh, you're good. think this infection got out of control so fast because she's molting, and their immune systems are pretty compromised when they go through molting. You can see how many pin feathers she's got. She is right in the thick of molting, so I'm just going to gently wrap her in this towel. All right, there we go. Let's take a look at your foot, my dear. Let's take a look at your foot. Oh, we got a couple kernels. All right. All right. Nope, no, you're not getting away. I have you. No, I have you. I know you know what's coming. And I know you're not thrilled. But, we're going to do this. Okay. First things first, these are the tweezers that have the tooth on it. So I'm just trying to get that tooth underneath some of this, oh, there we go, some of this infected tissue, to see if I can get a hold of this kernel to get it out. No. I know. No, you're good. She's already bleeding. Alright, I don't like this. This is not what I want. Put you there. You're alright. You're alright. It's alright. Oh, you're good. You're good. You're alright. Should we try this one? Sometimes you get lucky and they pop right out. Sometimes you don't. Come on. No. Alright. She's struggling a lot, so I'm going to put her more on her back and less upright. That usually calms them down a bit. I'm going to just flip her back a little bit more. And hopefully that will chill her out. There you go. Nice holding you like a baby. You a baby? Rory got her name last year when she was inside after I did her little surgery last year. I went through a Gilmore Girls kick and I rewatched all of Gilmore Girls and I thought, this is a good name for a chicken. Not Gilmore Girls, but Rory. So, well, come on now. kind of what I was aiming for. Haha. There we go. Okay. Okay. Sometimes we need to help soften the foot. So I'm going to just soak one of these cotton pads in that chlorhexidine solution, and we're just going to let it sit. And give it a few minutes. You have featherfoots. You're not a featherfoots. You're an Easter egger. Yeah. It is a myth that chickens don't feel pain. The truth behind the matter is chickens are not mammals. They're avians. They're aves. In their world, showing weakness is basically asking for death. Their flock, I mean, a poultry flock will kill its weakest member. So if Rory ever showed weakness, in spite of this foot looking like this, she'd be more likely to be attacked by her own family. So people say that, you know, chickens are very stoic. You can do whatever. She is in pain. So don't think that her lack of struggling is because she's not in pain. Don't think that because they close their eyes, maybe while you're working on them, that it's because they're totally comfortable with what you're doing. They're not. They just don't show the pain the same way that we do because they don't show pain. So keep that in mind. When I do put her away when we're done, I am going to give her just a flake, like less than a quarter of a low-dose aspirin in her water to help with pain, because she is very small, very, very small. She's not a Banty, but I'm going to give her, you know, roughly an eighth of a pill, of a low-dose pill, not the full strength. So she'll get a small amount of aspirin. And with chickens, you can really only give them aspirin for up to 3 days. I would talk to a vet if you think they need it longer. She shouldn't need it more than just today, to really help with her feeling more comfortable. So, yeah, she's a good girl. She's a lot more chill now that she's more on her back. I don't want her completely on her back because it's harder for chickens to breathe when they're on their backs. But she's very alert. Here, get her in there. There she be. But she's just looking around, just chilling. Yeah, you're just chilling till the next episode, right? Okay, let's see how we're doing. Here. Bleeding has stopped, so that's a plus. I don't have a garbage area. I was thinking, wasn't I? We'll put it there. Hokey pokey. Let's try this again. I think I'm gonna go in. I know, I'm sorry. And it isn't the area I'm poking. This is the infection that I'm poking at. It's the pressure that I'm increasing in the foot itself that's causing her discomfort. So I know, sweet pea. I know. getting somewhere, I think. I know. We might need that. We might need that scalpel. I got you. I know. And here come the turkeys. Again. I really hate that I'm like flicking this toward me, but I'm trying to flick it kind of toward the side of me, not toward my face. Because that would be dumb. There we go. All right. Oh my goodness. And that stinks. Oh my god, that stinks. That's so gross. But I bet that feels real good, doesn't it? So we got some infection coming out, which is good. Oh, it stinks. Okay. I lied. I'm really glad I'm wearing the N95 because if I were wearing a paper mask, the smell would be so much worse. Another benefit of PPE. Whew, holy moldy. I know, but it's going to feel better when I get some of this gunk out. Yo. Yes, ma'am. Holy moldy. All right. See, I'm trying to like... No, I know. Okay. Yuck. This is actually deflating kind of fast. I know. And actually, I don't know if I've ever had a Bumble that leaked like this before. I know I've never experienced the smell before. Holy moly. Although sauerkraut is worse. Sauerkraut is a lot worse. I mean, this just smells like infection. Sauerkraut is a whole new level of yuck. But, oh, can you hear that? It's just gross. It's okay, hon. I know. Yeah. So I am gently, very gently squeezing. I know. She's like, not gentle enough, lady. I know. Okay. Oops. Heller. All right. Okay. Let's continue on with the continuing on. Oh, I know. This is not your day, is it? Judgment. She's looking at me right now like, woman, you better stop. I'm gonna peck your face. I'm gonna peck your face. Remember how good you felt after we did this last year, Roar? You felt so good. You got a name? Yeah. Alright. I know, that fly scared me too. I know. You're alright. You're alright. No, you're fine. You're just doing good. I know. Why is the turkey coming back? Why? Because she can't help herself, that's why. She is a nosy turkey. Okay. I'm going to do a little irrigation. I'm basically going to take this syringe and try to get it into these little holes that I've created in her foot. So I'm going to do that over here because that's where the ground is. Oh, this is why we wear PPE. Yes, it is. Okay. Lucky you missed that, because that was gross. So, if you really want to know, it just looked like a volcano of infection and water. But we did get a lot of gunk out, so that's good. Okay. So, let's try these again. Alright. Just see if I can't. No. Okay. We need to cut all of this tissue away. Oh, there we go. This tissue away. So this is all dead. Now that we've relieved the pressure inside the foot, she's reacting a lot less. So we are going to, cut through my glove. That's why I have a pile of them. Ow! I'm sorry. I'm so sorry. She just bit me. Well, she pecked me. She didn't bite. Well deserved. I know. I know. I deserved it. I agree wholeheartedly. Don't peck my face. You're giving me that look again. I can see you out of the corner of my eye. Hello. Hi, Safflower. Why are you limping? Don't tell me you have a bumble. I really don't want to wrestle a turkey. I mean, I will, but we're going to need help. I guess I'm checking feet today when I'm done with this. Yeah, if your chickens are going to get bumblefoot, it's going to be when they're molting. So fall is a good time to do just general health checks on your birds. There goes one glove. Where's the thumb? There's the thumb. Alright. You know, I do not intend this to be an all chicken or all medical chicken channel, but that's kind of just how it goes, because I feel like these videos are important, and I don't have a lot of medical issues on my farm. You know, Fricassee, that was a dog attack. And she was prone to sauerkraut because she had a scissor beak, which is a beak that doesn't quite meet up. Your toe's in the way, honey. Move your digit. Thank you. Thank you. And I let this go because I wanted to film it. And it takes a long time to get set up. So I let this go way too long. But also, I mean, it's only been a few days, but if she weren't molting, it would not have blown up like this in just a few days. So, okay. Yo, I know. That was bad. I knew it as I did it. That was no bueno. Okay. We're doing good on this one. This one's almost cleaned up here. I know, don't bite me. I think my UPS guy here. I don't really edit videos because I don't have time. So if he shows up, you're gonna know. You're gonna know. Oh. Is this on camera? No, I apologize. Can I just talk about my stool for a second? Not, I went to, the state fair, not my state's fair, but another state's fair this year. And I found the coolest little stool that is adjustable in height, packs down to just a few inches in width. It's like, I don't know, it's like 4 pounds or something when it's, well, it's just 4 pounds. Came with a carrying, well, it didn't come with it. I had to buy the carrying case separate, but it has been the best little stool. I'm sitting on it right now because I have garden beds that are 2 different heights, 12-inch and up to 2 feet are the different heights. And yeah, it's been the best little stool. Is this a kernel? I don't know. It might be. See, last year her kernel was on the bottom of her foot, so I kind of wonder if that's just a scar left over from her kernel from last year. All right, more irrigation. And we'll just do it over here. Okay. I gotta say, I'm kind of digging having the 2 holes in the foot because it's a lot easier to just squirt water into one hole and have stuff come out of the other one. Kind of nice. Okay. Oh, I know, hun. I know. I'm sorry. All right. Okay. So all the liquid is out of the foot. There's no more liquid pus in her foot. Unfortunately, let's see if I can show this. All of the, can I point with my scalpel? Yep, I just touched that. That's gross. That's gross. It's just gross. All right, all of this yellow, that's infection. That needs to come out, but it's kind of attached to her foot. So, this is all gonna come out. And I might have to actually open this up in between these two areas to get it. Which, I mean, it is going to make her bleed, but it's better than leaving any of the infection in there. So I might have to do that. Don't know if YouTube is going to let me show any of that or not. And this video is already 47 minutes long. So I'm going to do that off camera. I'll do a follow-up after I'm done. I will do a follow-up to show you what it looks like when I'm done. And then I'll show you how I wrap it. So I'm going to do that. So for this video, thank you for coming along this journey with us. Hope to see you next time here at the Little Green Farmstead for a follow-up on how to wrap this when Cheryl done with the excision of the infection. Okay, thank you. Bye.